Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm pleased today to be talking with two gentlemen who are going to help us understand the roots and the path of what I'm going to call the Rosen story, which truly a remarkable what has been done by this company. With me is Ashley Bacote, who is Risk Manager of Rosen Hotels and Resorts and President of ProVensure, a consulting arm of Rosen Hotels. Thank you for joining, Ashley.
Thank you for having me.
And also Kenneth Aldridge, who is Director of Health Services for Rosen Medical Center and Rosen Care. Kenneth, thank you for joining.
We're honored to be here.
So let me ask you to go back to the beginning. What can you tell me about how this audacious experiment began?
So,
Ashley,
Larry,
no, I was going to say Ashley should take that one. No, you should take it.
Okay. So, Larry, back in October of '91, we received a large insurance renewal, and we were expecting to have a decrease in our premiums. We were fully insured at that time, and we were expecting to have a decrease in the premiums because our claims costs were significantly lower than our total premium. And we ended up getting an increase, and we said, Mr. Rosen said, why am I getting an increase? I'm expecting a decrease. And they said, well, your particular entity performed very well, but you were in a pool, and the pool did not perform well. And he said, I was not aware that I was in a pool, and I need you to just go ahead and take me out of that pool. We'll just stand on our own. And they said, well, it really doesn't work like that. You've got to be part of the pool. To which he replied, we're not going to be a part of the pool. We're out of here. We're done here. And so we became self-insured. We opened our own on-site medical center, the Rosen Medical Center. We hired an independent third-party administrator, and we started doing direct deals. The first one with the largest hospital chain here, and then we did some with some specialists. And so that's how we kind of got off of the kind of unsustainable big increases every year. We said we can't do this anymore. And so our first year in, our costs went down quite dramatically, and we've evolved over the years. We started off as kind of a basic primary care facility, and we've just applied common sense over the years, and it's evolved. So we had one part-time doc when we started, and a medical assistant and a front office person, and now we have a staff of about 60. I think we have 8 or 10 providers, and Kenneth can get into some of the details there. But in a nutshell, our goal is to focus laser-like on prevention. And again, Kenneth will get into the weeds on that in a few minutes. And we want to remove as many barriers to care as we possibly can. So what has ultimately culminated out of this is our costs are, and let me back up. We now have about 66,000 covered lives under our healthcare plan, and our costs are half of what our costs would be under the conventional healthcare model. However, our benefits are much richer. Typically, when you cut costs dramatically, there's a commensurate reduction in benefits, and this is not the case. So we do not have any deductibles, okay? We don't have any coinsurance. 90% of our drugs are free. And again, we do that through a lot of different ways, but when you really boil it down, it's taking a disproportional share of the healthcare dollar and allocating it to primary care. In the traditional healthcare model, the last sliver of the healthcare dollar is given to the primary care doctors, and that doesn't fund the tools that are needed so desperately to focus laser-like on prevention and to be that quarterback, that coordinator of all the care. So that's kind of how we got started. And I don't know if you want to ask a follow-up question or let Kenneth dive more into the weeds on where we are with the details of our program.
So I guess the one follow-up question I'd like to ask before I turn to Kenneth is, you said you had one part-time doc at the beginning. Was that Dr. Ryan?
That was not Dr. Ryan. Barbara, what was her name, Kenneth?
Hansen. Wasn't it Barbara Hansen?
Yeah, I think Dr. Ryan's been with us for how long, Kenneth? Maybe 7 or 8 years?
7 years.
Okay.
So one of the questions I'd like to ask is, what role did that Dr. Barbara Hansen play back in the beginning as you were thinking about your plan design and your service delivery design? Was this something that the physician was a part of, or is this something that was developed by yourselves? How did that happen?
So, Kenneth, you might be able to touch on this a little more than me, but typically how we operate is we as a group, so the Human Resources Director with Rosen Hotels, the President of Rosen Hotels, the Director of the CFO of Rosen Hotels, we're all kind of, and Kenneth and the medical team, we all kind of get together and we brainstorm what we want to come up with, and we allow everyone to share their ideas, and we put this thing together. It's not the doc that puts it all together, it's not Ashley that puts it all together, and it's not Kenneth that puts it all together. It is absolutely a very broad team effort.
Which is valuable, Larry, because each one of us are going to bring a different perspective. Like
right.
Ashley Cove, the insurance standpoint, the risk standpoint, the liability standpoint, the HR director from the human standpoint of the employees, and let's try and remove more barriers. Mr. Rosen, our CFO, about what is that initiative going to cost us, and how much is it going to save us on the back end. So it's really a team effort as we, from the medical side, from the clinical side, are looking at, hey, we'd like to bring on more this product, this drug, for free. And then, okay, what is going to be the ramification associated to that? Well, it's maybe a reduction in an emergency room visit or an urgent care visit, better compliance because it can be affordable. Here's a prime example, Larry. Several years ago, you've read in the paper several times, Wall Street Journal talks about insulin and how the cost of the insulin in the very beginning for the patent was sold for $1. Then nowadays you're reading how people can't afford the insulin because it could be $500 to $700 depending on their insurance. Right. We at Rosen, it was still very accessible, but we believe the right thing to do was to take it from I think it was a $20 copay, and that's unheard of, down to free. Absolutely free if you are a Rosen employee to have your insulin available to you for free. So we look at it as, number one, from a clinical perspective, it's going to help them be compliant. That's going to help them reduce an ER visit or urgent care visit, or
Right.
damage to the eyes, damage to the legs, to the kidneys. If we move them from, eventually needing a dialysis, that could be, $50,000, $60,000 a year. If it's a kidney transplant, it would be $70,000 a year. So we look at all that together, and we make those decisions together for, number one, what's the right thing to do? Number two, what's the right thing that we need to give to that patient? And, there's times we want them to have skin in the game, but maybe in this situation, let's take it back. But let's find a way that we can support that copay reduction that we as a company are losing, by finding ways that we can provide savings. And that's one prime example that our team did with the insulin and diabetes crisis.
So I'm curious. You struck on something. So I've been working in family medicine and the medicine field for quite a long time, and I believe in the power of family medicine and primary care to do what you're talking about in terms of patient outcomes and cost outcomes. What was it that led your team to see the potential of primary care to deliver these kind of outcomes?
Oh, from the very beginning?
Yeah.
We truly believe that primary care is the answer to healthcare, but unfortunately, we have a critical crisis in the number of primary care. We're not paying primary care enough. We're paying the specialists more. We should be funding and reimbursing primary care more so that they can control, have the resources, have the time for the follow-up with that patient, instead of, oh, well, they have diabetes, let's refer them to the endocrinologist. Oh, they have thyroid disease, send them to the endocrinologist. There's more if we have more time to spend with the patient. Like at Rosen, we have 30 minutes per patient, and we have even extended periods of time, so we can really figure out, what does this patient need? What does this associate need, this family member need? Because of, we need to look at not only the clinical, but the mental, the behavioral, their nutrition, right. All of those components that can lead to poor health outcomes. I mean, social determinants of health, it's a real thing. If they're living in an environment, and us as clinicians are standing back and saying, hey, you know what, you're diabetic, you need to walk around your neighborhood more. But if they're afraid of getting
right.
mugged or shot or those kind of things, well, then we shouldn't be bringing that as a resolution. We need to make sure that we're bringing them what they need, that individual, for their care. Because a Larry is going to be different than somebody who might be in a different level of socioeconomic impact.
And Larry, going back to your question, to really boil it down to something that's quite simple and has kind of evolved from that point. When we asked our doc, what is one of the biggest challenges that you have, and the doc said, I can't fix anybody if I can only spend 3 minutes with them. And we said, well, let's change that. You just spend as much time as you need to spend with them. And it just kind of evolved from there.
Well, I just want to commend you for that insight and for going with that insight. I've talked to many employers. I've talked to many people just across the board who do not get what is a fairly straightforward, to me anyways, and I think in your minds, a very straightforward idea. If you give the primary care clinicians the time to spend with the patient, they can get down to the root causes and begin to actually intervene in a way that can have these downstream outcomes. So I just commend you guys for seeing that and then following that path.
Thank
and
you.
and Larry, it's also important as we give not only the time to the providers or to the primary care, is to also surround them with the resources that they need. When we remove a lot of those barriers, such as, the bureaucracies associated to some of the, the prescriptions that are out there, or having physical therapy on site, because many patients will take, or at least our population will have to take a few buses just to get to
Right.
a service line. So our goal is always to bring as much as we can within the Rosen Medical Center model to increase the overall accessibility for the patient. If the patient's having headaches, and we determine, okay, it's not migraines, those type of things, and it's associated to tension, then maybe we'll have them see the chiropractor in our facility, and then we realize, you know what, they need to also do some physical therapy. Well, guess what? All three of those service line providers are under one roof and can actually consult together to really determine a care plan. That's value.
Absolutely. Absolutely. So take me forward a little bit. What were some of the first things that you did to describe your plan, your first steps in your plan?
In the health plan itself?
In terms of your plan design, in terms of how you communicate it with employees, one of the issues that I'm aware of is some companies have difficulty getting their employees to adopt the plan. That may be a well-designed plan. The employees are used to going to an emergency room for urgent care or acute care rather than using their primary care. So I'm just wondering how you implemented that in a way that got the ball rolling in the right direction.
Larry, our plan is a little bit different than most employers. Most employers, they're giving their employees, a choice of 2 or 3 different tiers on the health plan, and there is steerage to get them to choose the health plan that is much more beneficial for them, both from an outcome standpoint and ultimate pricing standpoint. Ours is a little bit different than that. And so our plan is mandatory, okay, and it always has been. If you want to be on the Rosen Healthcare plan, you have to use our primary care, and you have to go where we tell you to go, to a large degree. And you need to pull those levers that make the most, sense. And so there's not a lot of, steerage really. There's a tremendous amount of holding hands. When someone becomes eligible for our plan, we reach out and we hold their hand all along the way. If they need a nurse case manager, blah, blah, blah. If they need a coach, blah, we attach a coach to them. And that's how our plan works. Again, most folks, they have the critical mass to make it voluntary, and then you just steer them based on which tier they choose within the health plan design.
And Larry, many of the traditional primary cares, they basically will wait for you to call them for a physical or for a sick visit. It's really the MCOs and the ACOs, the accountable care organizations, that are trying to do outreach because they're ultimately at risk in relation to that patient and outcomes and cost. Rosen Hotels and Rosen Medical recognized the importance of doing that outreach so that the moment that they actually join our health plan, we do the outreach for that individual. And many a times, patients are brand new to us, have said, nobody's ever done that before. Right. And it's that proactivity that helps us realize, wait, this person that we just brought in has so many comorbidities that we're not in a proactive type of situation. We're now in a reactive, in the sense of their diabetes is out of control, or high blood pressure is out of control. They're coming from a third world country where they've had this out of control for so long that their body has been accustomed to it. And then we start treating them and lowering their blood sugar, and now they feel a little bit odd because they've lived with this for all their lives. So the model is proactive, preventative medicine. And when we can't do preventative, it's let's fix this, get them the care that they need. We also have pregnancy programs, and now our pregnancy program came from an oopsie, a black eye, because we really didn't have a nurse that would really manage our pregnancy population. And to give you some metrics, Larry, it's about 58% of our pregnancies are high risk, either advanced maternal age or whatever it might be. So we have a nurse and some other nurses that are actually responsible for all of the pregnancies, from initial diagnoses to making sure they're taking their prenatals, to making sure they're going to their high risk and communicating with them so that we can prevent a premature baby, which could cost us not only the baby's life or the mother's life, but cost our company, hundreds of thousands of dollars. And
Yes.
so really in the Orlando market, I think we're at right around 11%, 10 or 11% premature rate. And we've been able to keep ours around the 7 to 8%, even with the high risk population. Now, let's put that into perspective, Larry. We do know that premature is, anything greater, earlier than 35 weeks. Well, we've had, and it still counts against us, we've had moms that did deliver at, say, 31, 32. But the perspective is, hey, guess what? The baby that mother had before was at 24, 25. Imagine the savings. So yes, we get a ding because that's technically a premature, but look what we were able to do to save that mom, save the baby, and save our company.
Yep. And that is fantastic. So, and maybe you could describe for me you guys are familiar with how other employers handle healthcare. One of the questions I've had since I first learned about your work is, why don't other employers follow suit when you show what is possible? And I'm going to ask you to get into that more in a minute. How do you understand that other employers aren't following? You guys should be world famous, quite honestly. You are famous, but people should be calling you left and right and looking for ways to follow from you. What's your thought about that?
So Larry, we have gotten a lot of calls over the years. Our initial goal was just to share the secret sauce with as many people as we possibly could, and then they would tell 10 people who tell 10 people, and we can kind of, as almost like a grassroots
right.
method of spreading this thing across the country. And I think what would happen is people would come, they would listen, and they would just decide it was too heavy of a lift for them. And they really wanted someone to do it, for them. And so within the last 3 years, and again, our initial thought was, tell them it's not that difficult. They need to do it themselves. They will handle their money and their employees and the health of those employees much better than any outside party would, because it's their family. And again, it was a heavy lift, and now in the last 3 years, people have been coming into us saying, can you do this for us? And so we kind of reluctantly started with our first very large client, about 10,000 covered lives. And I don't want reluctantly to sound a kind of a negative. We really wanted them to do it themselves. They really wanted us to do it. And so we said, okay, we'll be honored and glad to do it for you. And so there is a grassroots movement around the country right now of folks, consultants like myself, insurance agents, benefits agents who are doing what we've been doing at Rosen for 30 years. They're doing it for their new clients, and it absolutely is cutting their costs by 40% and bringing them much richer benefits, meaning no deductibles, no co-insurances, that sort of thing. So that is beginning to happen, and it is really starting to, not moving the needle in a big way yet, but these employers are telling their stories publicly now to say, wow, I just didn't think it was possible, or I thought it was going to be too heavy of a lift, and goodness, we are now cutting our healthcare costs in half and providing much richer of a benefit.
So that is absolutely music to my ears. So I will tell you, I've been working with family docs. I've been on the faculty of 3 medical schools. I've been a consultant to many others, and we are aware that in almost every medical school in the United States, if a medical student says to one of their faculty or to a dean, hey, I think I'm going into family medicine, that faculty member, that dean will take him aside and say, look, you're a bright young kid. Don't waste your life going into family medicine. There's others who can do that. You need to solve the riddle of cancer, or you need to do whatever. And so the reason our organization exists is we are working to promote medical student interest in family medicine. And we think it's irresponsible and egregiously wrong for the medical schools, which are all tax exempt, not-for-profit organizations, to not be responding to the needs of the community that can deliver these kinds of outcomes. And so as we've been brainstorming about how do we grow a movement that will put pressure on the deans to change, and by the way, they do know how to do it. It's been well researched. They don't do it because of a variety of issues, but how could we create pressure? And we think employers, particularly self-insured employers, working with us and us with them, could make a great difference. So we are hoping over time, call it a grand alliance. I mean, we need something better in the United States than what we have right now. And while the docs in the system have a certain amount of influence, the systems are so powerful that the docs are somewhat handicapped. So it's just music to my ears to hear you talking this way, and just love an opportunity going forward for us all to work together so that we get something better for America.
Very well said.
Absolutely.
So tell me, what are the things you're most proud of? This is an extraordinary story. What are the things you're most proud of that you've accomplished?
Ashley?
So Kenneth, I've heard you respond to questions like this, and you're so passionate about it. I think I'm going to defer to you on this.
Okay, not a problem. So Larry, we are proud of that Mr. Rosen was a visionary 30 years ago, that he saw the power of doing it yourself. He saw the value of primary care, and he has supported us throughout this entire endeavor. I'm proud of that Rosen Hotels and Resorts looks at access, quality, service, cost, and innovation, and proud that we don't have deductibles, we don't have co-insurances, and very low premiums. I'm proud of our teams that have created, where we've got medication compliances up in the 96%. I'm really proud of what we've accomplished to give our associates the tools that they need to be able to control their health. I'm really proud of Rosen Hotels for looking at things other than medical too, and supporting the behavioral health issues, supporting the mental health issues, supporting the wellness initiatives, and ways that the patients can try and take care of themselves, and giving our medical community, our medical center, the tools that we need to be as successful as we can be. I'm very proud to be partnered with Rosen Hotels, because there is nobody else that's out there like that, that all of us will always say, what's the right thing to do? What's the right thing to do?
That's fantastic. So there's one of the other things I wanted to ask about, and you haven't mentioned yet, is I've read up about you. One of the things that's happened in America over the last, at least the last 30 years, is the middle class hasn't gotten a raise, really.
Oh, yeah.
They're, all of it, what would have been the raise has been sucked into health insurance and the cost of health care. And you folks are, if I understand it correctly, you are raising the compensation levels for the individuals, and you're taking the dollars that you've saved, at least some portion of them, and reinvesting that in the employees and their families and their communities. Could you speak to that, please?
Yes, Larry, that is correct. But you know, just the fact that our employees don't have deductibles, don't have co-insurances, and 90% of their drugs are free, that in itself is giving them a nice pay rate. Okay?
That's true.
Right?
Yep.
But you know, we've saved close to $500 million with a B dollars on our program over the years, and Mr. Rosen does give back to our employees, gives back to the community. So, for example, actually, I've got a live example right now. So my youngest just graduated from high school, and he is going to get a scholarship for college. If you have worked for Rosen Hotels for 3 or more years, your children, okay, will get their college paid for. Now, listen, it's a safety net. If they're smart and they win 100% full paid scholarship on their own, well, then there's no need to use the safety net. But there is no reason why your child cannot go to college if you work for Rosen Hotels. Now, in addition to that, Mr. Rosen has adopted 2 underserved communities in Orlando. So anyone in that community, any resident in that community, in those 2 communities, if they have children, those children, 2, 3, and 4-year-olds, get free daycare. And then part of that, okay, is we are able to tutor those children. And then when they graduate, so they enter first grade, you know, reading, and they're little sponges, and so they enter first grade intellectually at a higher level than every other socioeconomic group above them. But when they graduate high school, they get a free ride to college, books, tuition, new room, board, everything. And that is returning. It's a 7-to-1 return on investment to the economy, because when you graduate high school, you're going to make more over a lifetime than you would if you didn't.
Yes.
When you graduate college, you're going to make a lot more than that. And I could, you know, go into a lot more detail on these programs, but it basically turned crime-ridden neighborhoods into neighborhoods without much crime at all. There's always some crime, and it's given those residents hope, and it's we're convinced it's what our country needs. Mr. Rosen says, we can change the face of America, one underserved community at a time.
Yes. Absolutely. Absolutely.
So
So,
Larry, I'd like to, if you have 1 second, I just want to tell you about a time where Mr. Rosen was going to pick up a prescription, and when he went there, he pulled up, the pharmacist said, "Are you Mr. Rosen?" And he said, "Yes, I'm Mr. Rosen." He said, "You don't know me, but I'm a pharmacist now because I went to your Tangelo Park program and got a scholarship from you, and now I'm a pharmacist." That is what we're talking about.
wow, that is, wow, such an amazing, really blessing.
Yes.
Yeah, just wonderful. So there is a book that you may be familiar with called Conscious Capitalism. Are you familiar with that?
Yes.
So you all are one of the penultimate examples of what that book is all about. You see your employees, you see everyone, you see the communities where your employees live as stakeholders, and you are honoring them. And I just, it's, I've read about what you've been telling me, and hearing it again. I mean, each time I hear it, it's just incredible. It's remarkable. And on behalf of all the people, I'd like to say thank you for your vision, and thank you for what you're doing. I do believe this is how we turn America around.
I agree.
Yes.
So we have a few minutes left. Any other points that you want to stress that you think are important for others who are going to follow in your footsteps?
You know, one thing that we didn't mention is, and it's probably just obvious, but our compliance rate with chronic condition, you know, the chronic condition disease and doing what they're supposed to be doing, our compliance rates are 2 to 3 times the national average, and that just, I think, speaks volumes of why our folks are healthier and than they would be otherwise. We still have some big folks that are not healthy, and our costs are considerably less.
Yeah, Larry, did you know 75 to 85% of your healthcare spend is going to be spent on those chronic care conditions like high blood pressure, diabetes,
Yes.
high cholesterol, those type of things. And so the more those individuals or those employers can give their associates the resources without creating barriers, the better it's going to be for them.
I absolutely agree. And again, kudos to you for seeing the vision. We in family medicine in particular, my whole time, and I started in 1978 at Penn State Hershey, in Hershey, Pennsylvania. The whole time that I've been engaged, that's been a part of our core belief. I call it the promise of primary care. And when I hear someone like the two of you and your company that so heartily embraced primary care, I just have to say again, thank you. And how do I, with this summary that I'm going to put together, I'm hoping it'll be something that we can inject into the system for other employers. I know you guys, you're familiar with Dave Chase, correct?
Yes, sir.
Yes, sir.
So Dave and I got connected back in 2013. Our organization found direct primary care in 2008. We have something called an Innovators Network, where we go looking for what we call primary care driven solutions. And we found direct primary care. We brought the leaders together and they presented at our meeting, blew everybody away with what they were doing. And then in 2013, working with those leaders, our organization held the first national summit, and Dave Chase came as a speaker. So Dave and I have been working together, and what he's doing is fantastic, trying to help the broker community and trying to help the employers to understand what you understand. And so I do feel as though there is a movement that's begun. And again, I just want to thank the two of you and thank your company for your vision and your determination to see this through.
Well, thank you, Larry, for the kind words. We appreciate that, and we appreciate folks like you out there that are, everyone who is passionate about this is playing a role. And listen, we could not do it without folks like you. And our goal is just to continue to, talk to as many folks like you as we can, and kind of play whatever role we can into helping us ultimately get to where we need to get.
Well, I think those of us who see the vision need to be working together, and we need to be, as I think of it, as a kind of grand alliance to move the country forward. That's what's it's not going to be a top-down, in my opinion, it's not going to be a top-down solution in the United States. It's going to be a bottom-up solution, and employers have a very powerful role to play. So if there's anything that I can do to help you and your team, all you have to do is contact me. You've got my email address. We'll be talking again, and I'll be listening in on your presentation on Friday. But I really mean that. If there's anything that we can do, we would be happy to help. That's how the revolution's going to happen.
Thank you, Larry, for having us. We really appreciate it, and call us whenever you need us.
Great.
Thank you very much, Larry.
Thank you, Ashley. Take care.